Hi, I'm Dr. Rudy Cashman. I hope you had a nice holiday. Today we're speaking a little bit of a serious subject here, but I want you to know there is great hope. Great hope. I've practiced neurosurgery almost 50 years, but about 40 of those years I was a wellness doctor because I felt 80% of the patients, I could get them well by teaching them exercise, proper nutrition. So, even in cancer, which you may think, oh, I have cancer, this is hopeless. It's totally ridiculous. I'm backed up by the literature. I'm very knowledgeable in that, and I would like you to listen and then develop some knowledge. Many of us lack knowledge, including the medical profession. Some people don't know about the mind-body connection in cancer and don't really teach it. But I've reviewed the literature, the science behind this, and you must participate in your healthcare. So if the wheel of wellness, I have 8 things, and then one of the spokes is, number 1 is participate in your healthcare. That means I don't want you to just say the script to the ill and you don't learn anything about what you got and look at the whole picture. I do want you to right off the bat, if they recommend different medications and drugs for every cancer you may have, read about it, become knowledgeable about it, and participate with it. I'm not against that. This is in addition to anything else you feel you might need to take. And I'd like to tell you right off the bat, the biggest pharmacy in the world is in your brain, This is science. It's science. It's right out of books, and I will explain this to you. So let's go on this journey together. We have about 600,000 cancer deaths a year in the United States. I mean, that's a pretty good number. Richard Nixon said in 1971 he would declare war on cancer, and in 5 years we wouldn't have it. Well, that didn't happen. And now we find they want to do this over again, pouring tremendous amount of money into research. That is wonderful. I agree with it. Even the local Vera Bradley here sends all the money they raise down to IU for research. They leave none of it here to teach us about wellness and exercise and nutrition, which could prevent probably half the breast cancer. It's right out of the literature, right out of the Mayo Clinic books. Got them at home. Look it up. So there's a tremendous amount of prevention can go on, and even when you have the disease, you can double your life, increase the spontaneous cures. So let's get going. So about 900,000 people in this country do have cancer, and they're living with it, okay? And about 600,000 are cured. That's a pretty darn good cure rate. You know what I mean? That's a combination of tremendous number of things, including there are some medications out there that have had a tremendous effect and continue to have an effect, and improvements are occurring. So there's a lot of hope here. This is what I'm saying. So about 60 to 80% of the causes of cancer are related to a lifestyle. You mean we could prevent 60, 80% of the cancers through proper lifestyle? Yes. How you use your fingers, whether you smoke or not, whether you drink a lot, what you put on your forks, the type of food, and how you use your feet, how you exercise. Dr. David Katz, the most famous public health official in the nation, wrote a book called Disease Proof. I recommend you read it. I met him. He's from Yale University. And he says on the cover of his book that 93% of type 2 diabetes can be avoided proper diet, 80% of vascular disease, 60 to 70% of cancers can be avoided by how you use your fingers, your forks, and your feet. Opportunity, opportunity, opportunity. Yet, I speak to most patients. I hardly ever speak to a woman that knows you could cut the breast cancer rate in half if they had a proper lifestyle of exercise, proper weight, positive thinking. Yes, it's dramatic. It's in the literature, and I'll show you the names of the books even. I even wrote a book about it to the point, and I'm not here selling books. I'm going to recommend a lot of other books. I want you to become knowledgeable. Healing Cancer with the Power of Your Mind, Love, Hope, Faith. It's a book I wrote a number of years ago. It's on Amazon. It summarizes it for you. You could read it in 2 or 3 nights. and you become very knowledgeable. So what lifestyle things can affect your cancer? Whether you smoke or not is obvious. How much alcohol you drink, which increases liver cancers, and cancers in every part of your body are related to alcohol. Yes, to excessive alcohol consumption. What type of food you're eating, mainly sugary foods. Let me tell you something right off the bat. This may shock you, that cancer is a sugar feeder. Cancer is a sugar feeder. To prevent it, or if you have it, to eat a nutrient-dense diet. We need a certain amount of sugar. That's what produces energy in our body. But if you get to a normal weight, some people with cancer have trouble even keeping the weight up, no less down. That reduces the amount of sugar in your body. Cancer cells do not require as much insulin to get sugar into the cell, and the more sugar they get in there, the more rapidly they grow. And so cancer is a sugar feeder. Interesting. So it's the increased rates of cancer, as I mentioned already. If you're overweight or obese, it's a judgment-free zone. I'm here to teach you to become well, a judgment-free zone, okay? Who hasn't had trouble eating food or sugar? Let's face it, sugar is addictive more than cocaine. I get a stressful day. If there's a donut at home, I'll be eating it. I don't allow it in the house, but even myself with 99% good health habits can be tempted into that. It's more addictive than cocaine. So sugar, one of my latest books is called The New Slavery. We're slaves to sugar. And so that's on Amazon too. Lack of exercise has increased rates of cancer. Actually, 40% of Americans develop cancer. But if they exercise regularly, you know what their rate is? 15%. Wow. It's right out of this book by Patrick Quillen, To Beat Cancer with Nutrition. I highly recommend you read this book. Very thorough, been around for a long time. And it's not just about nutrition, it's about exercise. It's a wonderful book to read. I suggest if you're diagnosed with cancer and you're concerned about your life, that you develop a little library of books you like to read. No, not many, maybe 6 of them or so, and I'll go through those. Maybe what I even like you to do is sort of visualize, because visualization is how you speak to your subconscious mind. Visualize a little room you've developed, and maybe a piece of paper and a pencil, and you write down what you want in this room. Books. You want to read. You want to do some reading. So we're going to deposit about 5 or 6 books in your room for you to read. Maybe we'll add some exercise bikes or whatever, or some tapes, a little screen. You could watch some yoga tapes, some exercise tapes on them would be excellent. So Candace Pert, who I met personally once because I took my neurosurgery training. Incidentally, I did neurosurgery 45 years, and I tell you, 35 of those years, I was a wellness coach to my patients, because I realized the majority of patients I was seeing needed wellness teaching. They didn't need all the fancy stuff. So that's the reason I'm a bit passionate about this. I stopped neurosurgery 3 years ago. Now I'm the wellness director of Lutheran Health Network, and we have to thank them for hiring me to do that. And but modern medicine in general, I don't think embraces all this, so I'm really trying to promote it. And thanks for watching the show because of that. Candace Pert, 1972, published a book called Molecules of Emotion. Yeah, and she was the first one described where do medications in our body, okay, drugs are made in our body, our neurotransmitters, our hormones, our neuropeptides, how do they act and affect our cells? We have 70 trillion cells in our body. 70 trillion cells, but every one of those round little cells, mind you, we're talking about real small, nano-size cells, have on them receptors. These things sticking out, some have 1,000, some have 10,000 receptors. She discovered where taking morphine IV or by mouth, where it acted. It hit these receptors, which opened the door to the cell, and the message of morphine was sent to the cell. First one, 1972, Candace Pert should have gotten the Nobel Prize, but there was some argument in front of the Nobel Committee because her boss wanted it, but he didn't invent it. She did, through radioisotopes. She didn't get it. that was certainly a terrible thing. She should have gotten it. So she discovered how every medication made in our body, our hormones, our neurotransmitters, our neuropeptides act, and the external ones act in our body. She is the one, in essence, what she was saying, brain speaks to our body. Yes, hormones. We make 50 hormones a day, would you believe it? When I heard that, I mean, how can we even think straight every day? We have 50 hormones that have to balance, and how we feel depends a lot on those hormones that affect ourselves, because some of them are targeted than others. And then neuropeptides, about 350. They're proteins like insulin's a neuropeptide, for example. And then neurotransmitters, we get about 40 of those, but 40 different kinds. But we have a trillion of them, maybe more than that, a trillion neurotransmitters. They're the ones that jump from the axon, the extension of your cell, to the dendrites of the next cell that jump across here, send a message to this cell. Can you imagine trillions of neurotransmitters, about 1 billion cells in our body? It's amazing the number of brain cells that we have, for example. So our brain, through nerves, actual nerves, through the autonomic nervous system, parasympathetic, the relaxed, the sympathetic, the stressor, through hormones, neuropeptides, neurotransmitters, speaks to our body. So how we think becomes critical. It affects our immunity. They have traced actual nerves to the spleen and to the thymus and to our gut. Our gut makes 50% of our lymphocytes. Our defenders, our Army, Navy, Air Force defenders of the body are made in the gut. And hormones and neurotransmitters speak to our gut. So positive thinkers, for example, they have found are much less likely to develop disease. And negative thinkers, for example, stressed people following the death of a spouse, for example, lost a job, people for good reason become negative thinkers, and they have increased rates of cancer. Yes, the most common cause of cancer can be stress in a spouse of someone who died. Yeah, this is well in the literature. They have studied that. So then Candace Pert discovers the monocytes, part of our Army, Navy, Air Force, and Marines that are defending our body, our lymphatic system. The monocytes make the same neurotransmitters and neuropeptides. So our mind speaks to our body, but our body speaks to our mind. Begin to see my point? That the mind's important. Yet, you go to most cancer specialists, they never bring that up. They never bring it up, that how you think can tremendously affect your outcome. I've had patients who say, I'm not going to die. And then I followed them. You know what? I had one with a highly malignant brain tumor, a guy in Columbia City. The first thing I saw him when I told him this horrible news of this very malignant tumor sitting in his speech center of the brain. He says, Doc, I'm not going to die. Well, he happened to go to the right doctor because I taught him about positive thinking and exercise. And I did give him the latest medications and radiation that was available. Even took him to the University of Cincinnati, and they were part of this. And he must have lived 10 years with this highly malignant brain tumor. When I scanned him about a month before he died, there was no tumor there. And I'm not even certain why he died. Maybe the residuals of all the treatments. I don't know. But he's the longest lived person with this highly malignant grade 5 glioblastoma. But I know his mental attitude, and he happened to go to the right doctor. I went right along with it. I was always available to him, met with him with his optimistic, cheerful wife. I even visited his business, and we really supported each other, and he made it. So Candace Pert's work is extremely important. It's the science behind what I'm saying. So your thought process, how you think, has tremendous effects on your body because your thought process affects your body. Gershon wrote a book called The Gut, the Second Brain. Read that. It's fascinating. It's fascinating. You know, if you're like in med school, when I was stressed, I mean, and had a test the next day, and I wanted to be a doctor so bad, I think my heart would beat about 3 times a minute. I hear lump, and I had to wait about 20 seconds for the next beat. That's the sympathetic nervous system affect the heart. But now in my life, I find like it's if I'm stressed about something, it affects more of my gut instead of my heart. We all have sort of target organs, so you have to become aware of your immunity. They found depression really is almost a surrender to death. Yeah, if you have this problem, you go into severe depression, it makes it much worse. The way your brain speaks to your body, the way your immune system reacts to your negativity. The doctor says you get 6 months to live and gives you no hope. Bad deal, bad deal. I've seen that before. And they can almost do a voodoo to you. You know, the witch doctors years ago, if they pointed at you and you believed that the rest of your tribe wanted you dead, many of the people died. It's called the voodoo. The thing is, they did because they'll have fibrillary degeneration of the heart, their thought process, the adrenaline affects the heart, pulmonary hypertension, they're dead maybe on the spot. Yeah, that's been proven. Articles have been written about it. That's been fully proven. So the threat of death can be deadly in itself. People go into severe depression, so depression can be a surrender to death. So it's quite important to try to get around this if this is possible. Gershon LaShan wrote a book years ago, excellent book to read. This is one of the 5 or 6 books on which you put on your imaginary room you're going to construct while we're speaking here. Cancer is the turning point. What's very interesting, Lawrence LeChan, L-E-C-H-A-N, practiced medicine in New York City. That's why I used to live as a child. I lived on 149 81st. Would you believe it? Down the street from the Metropolitan Museum of Art. Good God. Well, LeChan practiced medicine in that area. I never met him or anything, but it's in that book. In the Metropolitan Museum of Art. It's just down the street. I used to walk through it as a child with a baseball bat on one side and tennis racket on the other. True story. And he would take a lady with metastatic breast cancer that was all over her body. He would take her once a month to lunch there. They have a nice cafeteria. And then he would take her to visit her favorite art for a half hour, walk through the museum, look at her art. In essence, it was art therapy. Well, one thing about art therapy, it stimulates your imagination, your subconscious mind, and your imaging. And through imaging and images, you can speak to your subconscious mind. Very interesting. That's been proven. Imaging is very important. He restudied her 5 years later, no cancer. Is one case proof? Absolutely not. But it's in his book. Well, he turns around then and studies hundreds of patients, and he found 500, for example. If there was negativity, even as a teenager or in a young part of their life, a very negative family, for example, a lot of stress in their life, a lot of turmoil in their life, a lot of poverty in their life, cancer rates went up. Yeah, he went up almost 300%. And it's right in his book. It's great reading with many stories in there, but this one from the museum is a very interesting story. So I encourage you to read LeChan's book. So hopefulness and hopefulness are very important. Hopelessness, if the doctor says, well, you get 6 months to live, odds are that's probably all you'll live. But if he speaks to you and says, well, 10% of the people really do quite well, then I'm going to do everything I can to get you in this group and give them a big hug and teach you other mind-body methods besides giving you usual chemo, whatever radiation, whatever you need, the cure rate goes up. Yes, Elliot Gould, famous evolutionary guy, I mean, after Darwin, probably the most famous developed cancer. And it was a type of cancer where it really didn't look good. And they told him the statistics, you know, survival rate 2 years, maybe 1%, and they showed him the bell curve. But he said a very important thing. That's a number, but I'm not a statistic. I am not a statistic. So you got to look at the tail end of the curve, you know, like a bell curve goes down, and say, it's just a scientific study, but it doesn't have to be me. Well, he lived for about 30 years, I think, after that. And so how you think is very important. So we want to get away from hopelessness and convert you to hopefulness. The more knowledge you gain, the more hopeful you become. Without knowledge, if you just take the script to the ill, whatever they're telling you, probably going to happen. You want to get away from that. You need to get away from that. You need to be more a positive thinker. I tell you good books to read too, which is not my collection here. It's Norman Vincent Peale. He used to be minister in New York City. I had a patient that I cured his wife of something, nothing that difficult, but he was so grateful. He used to work for him, and he brought to me, as a present, 21 books of Norman Vincent Peale. The Power of Positive Thinking, You Can If You Think You Can, Imaging, Visualization, all Norman Vincent Peale's books. He preached out of the Marble Church in New York City on 29th Street, 5th Avenue. Interesting enough, 2 years ago, guess who went to the Marble Church? I did. Norman Vincent Peale is dead, but I drove up, and I was greeted, frankly, a man standing right at the curve. The taxi or limo opened up, and I stepped out. Welcome to the Marble Church. When I told him that I have all his books and read them all, give lectures on the power of positive thinking, they really wouldn't let me go. I spent hours in there. As I walk out the side from the basement, where I'd spent a lot of time speaking to the minister and assistant minister, all women, incidentally, because Winston Norman Peale died a number of years ago, and his wife, Ruth, died maybe barely 2 or 3 years ago, lived to be 102, I think. But those books that I have are all autographed by him and his wife. Yeah, would you mind? What a privilege. And he gave them to me because he said, Doc, I think you'll read them. So Power of Positive Thinking, these are great books to have. They apply to any part of your life. And Douglas Shan, incidentally, had one main recommendation. If he could take that cancer patient and keep them at work, or to develop a purpose in their life, I have something I got to do before I die. He found that the lifespan of the cancer patients doubled, okay, and the spontaneous cure rate went up. Wow. Yeah, a purpose in your life. I want to see Johnny graduate from college. I want to continue teaching this. I love my job, and I want to see this to a certain point. If you can develop a purpose in life, you will do a lot better. This I think is a big thing. I remember Rick Warren wrote a book called A Purposeful Life, and I think it's a good book. And you don't even have to. It's a very religious book too, but I don't think you need necessarily totally that, but purposeful. But since I mentioned that, purpose, spirituality and belief in God are very, very helpful to healing too, because they cause, again, that positive thinking through spirituality and religion will cause neuropeptides, neurotransmitters, and hormones go to your body and help your healing. It's real. Spirituality and religious thoughts are real. They're real. They lead to healing. So I highly recommend that. So to develop a purpose in life, I think is a wonderful thing to do. Bernie Siegel wrote a book, Love and Healing by Bernie Siegel. Wonderful book. I think he was up in Michigan here, actually. Wonderful book. I encourage you to throw that into your library. Love and Healing, because again, the positive message that love, the feeling of love can send to your body can help in the healing. I think it's, and he noticed people just live longer, spontaneous cure rates go up, so I think it's a good one. Now let me speak a little bit about, and I even wrote a book on it called nocebo, Nocebo, the evil twin. Yeah. Placebo, you all know the term. Rarely do I speak to a provider, no less one of us, to know what nocebo means. Very rare. I didn't always know it. I picked it up in a book I was reading, and fortunately many years ago. And what is saying, the placebo, how does a placebo work? I hand you a certain color pill, I recommend a certain procedure. It can be an operation. It can be a hug. It can have a 70% cure rate because you believe it. Yeah, a lot of operations work because you believe it. Oh, the operation cured me. Well, did the operation cure you? Or was it the placebo effect of the operation, the positive thinking, and 3-4 months later you're off and running with something else? I see it all the time for people with mind-body illnesses, the Candace Pert thing. I even had the mind-body index in my book I wrote called Welcome to Your Mind-Body, which is Candace Pert wrote Molecules of Emotion, where she described what I described to you. But I followed a few years later with Welcome to Your Mind-Body, where I explained that. The placebo, nocebo. The placebo, positive thinking, can be a pill. It can be anything. As long as you believe it, you're better. What's the nocebo? The opposite word. And what do we do in medicine today? We nocebo people all day long. We pick up a six-page MRI report, and maybe you're 60 years old and you have some drying out of the disc. That's normal for that age. And the radiologist reads in 6-page report describing every little dinky little disc and things, every part of your body. If an MRI covers your whole body and you go in there with a neck pain or a backache, and it may be from stress, maybe from tension, and the provider says, you need a back fusion. How much of that do we see? How often do we see young women with little scars here who've had their neck fused because they're stressed out because they got 5 kids and the husband not bringing any money home, and the relationship isn't too good, and somebody's taking drugs or they're drinking too much, and they get noceboed into an operation. Well, cancer is the same way. In negative speak, the provider gives you all these negative things. It's like watching all these advertisements for diabetic medication you see on TV today, and then they follow, with 2 or 3 minutes of complications from the drug. They totally eliminate the placebo effect, which may have been actually the biggest effect of the medication to begin with. Yeah, most medicines don't work that good. Some insulin, that's a big drug, okay? Seizure medication, okay? But a lot of medications just got help 10%, 20% of the time. You eliminate the placebo effect, so the nocebo effect can have tremendous effect. I can think my son's a neurosurgeon. He was, I've said it before on TV, and he said, that's fine. I had a patient with a small brain tumor and had a seizure, 35 years old, 4 children, no husband. And she says to him before surgery, well, what about this tumor? And he says, well, it's highly malignant, probably glioblastoma. How long will I get to live? He says about 3 months. And that's all he said, okay? He didn't know this at that time. And so he's telling me the story, Dad. I think I know what you're talking about now. She started screaming, screamed all night. Do you blame her? If I had 4 or 5 kids and had no husband, and I'm told I'm a malignant tumor, I'd be dead in 2 months, wouldn't you scream? We all would. And then the next day, biopsies, the thing comes back in. He says, well, doctor, what did confirm it? Yeah, confirmed it. Again, this conversation. She screamed in the louder. And the next day, this little tiny tumor, she was dead. Why? Well, you know why. I already told you. Voodoo effect. That's the extreme extension of the nocebo, negative speak. So angiograms, MRIs, CT scans, words, blood tests, all can be nocebos. So you must participate in the healthcare and know, what does this really mean? Are they giving me hopeless information or a little bit of seriousness with some hope? That's critical. I think you understand the point now, how important the placebo nocebo is. It's not taught in medical school, which is kind of shameful because we nocebo people with procedures and things all day long. Providers must understand that We need to give some hope, even in the most serious situation, even if on occasion we exaggerate a little bit, because the power of this thing, there's a doctor living within us, Herb Benson says from Harvard. He knows how to heal us. You get a cut, this doctor in us knows how to heal you. You think if you have a cancer in you, your body does not attempt to try to heal you? Give me a break. You know, it's been shown that we make some cancer cells every day, every one of us. The only reason we don't develop cancer because our immunity destroys them every day. That's true. We make some cancer cells every day. So how you think, what you're eating, is going to have, nutrition plays a huge part, going to have an effect on your cancer. So even Osler, at the turn of the century from Canada, said, it's more important to know the person than a disease they have. Wow. It is more important to know the patient than a disease they have. But today, you can see, and there are reasons too. I mean, some of these are related to the way the system is, the computer. You get it all put it in the computer or you don't get paid. And that takes about half the time. They see for 10 minutes, 5 minutes, it's spent on the computer, not looking you in the eye. They can have a very negative effect. Most providers don't know their patient. We patients have a problem too. We don't spend a little bit of time looking for a provider that we could stick with. Now, these healthcare plans may, from year to year, send you to another doctor. Well, what do you think? The next guy don't know who you are. This is a problem. So the system itself is destructive. If you can find a loving family doctor or PA or nurse practitioner, this is great. Stick with them. Stick with them. They know you. The first thing they should say to you, unless you're dying or fell out of an airplane, say, what's going on in your life? If they ask you that first, I'm telling you, you got a good provider. You better stick with that person. Family doctors, they don't graduate from Harvard Med School. 4%, maybe 5% of people become family doctors. They could really be the storage of information, but they're not. Even our computer systems aren't helping much. In Europe, you go to France, they give you this chip, and your life medical history, or Sweden, is on this computer chip. The whole life medicine is from birth. Here, you go from one hospital next, and they can't even transport the information a lot of times. It may change over time, but that's shameful. Pasteur, who developed the germ theory of illness, you know, people used to die from infectious disease, they still do today, but it was much worse. Was speaking to Claude Bernard, who wrote a lot about hormones and the mind-body connection, and Pasteur was dying, and they had always argued what's more important, the germ or the soil that it grows in. And when Pasteur was dying, you know what he said to Claude Bernard? I agree, Claude, I agree. It's the soil. It's the soil. That's all over the medical literature. So the soil that you provide, your body, your thought process, is more important most 90% of the time as a cause of your illness. So what the good news is that if you improve the soil, the way you think, what you eat, what is growing in your body, the chemistry of your body, you can avoid most diseases. Just like Katz says, in disease-proof your life, hell, it's right in there. It's right in there. So we know there's scientific proof. And today, unfortunately, most of us don't participate in healthcare. The doctor says, operate or take this medicine. This is what we do. We don't get on the computer, spend time, talk to friends, get second opinions, and it can be difficult. It's lack of knowledge. I'm not blaming anybody. I'm just pointing out the facts and encouraging you to participate in your health care. Remember my 8 wellness things? Number 1 is participate in your health care. Number 2 is exercise. Number 3 is nutrition, okay? Number 2 is nutrition. Number 3 is exercise, to go down the line. I already mentioned Bernie Siegel's book, Love, Medicine, and Miracles. And Carl Symington and his wife published books too about the mind and the body and nutrition. They did huge studies to find out that if they can improve the thought process and what you're eating and exercise, the cancer rates go way down. So the will to live becomes very important. You get a diagnosis. Most of us, cancer patients who develop a serious diagnosis, many go into denial at that point and they come out of it in a few weeks. And can you blame them? Can you blame them? I mean, you get 4 or 5 kids that tell you get 6 weeks to live. I mean, but some people don't go into denial. But then the will to live is important. I'm not going to die. I'm going to do everything I can to stay healthy. I'm going to develop a purpose in life. I may even need to change my life if I can, develop a new thing I couldn't do. I'm going to be a missionary, which I couldn't do. I mean, these are hard things to do. But if you can develop something where you become a positive thinker and increase your will to live, this is, I think, very important. He is Getting Well Again by Carl Symington, and it's a revolutionary, life-saving self-awareness techniques, Getting Well Again. Put this in your library, in the room, your cure room that I want you to establish. Again, it's about our thought process, our hormones, our neuropeptides, our neurotransmitters affecting those receptors in our body. Our cells react to your every thought. Every thought causes a reaction in your 70 trillion cells. You see how important this is? So anxiety, stress, depression. So the will to live is under attack. It is under attack. So stress increases cancer rates. So physician must be a teacher. It means teacher. So if you go into a provider, nurse practitioner, nurse whatever, if they're not a teacher, it's a problem. They need to teach you. It's not just script to the ill, procedure to the ill. Okay? Rene Descartes, 1635, going back in history, cut the head of the body, gave it to the church, and gave the body to science. And this is the way we've been practicing. We've been practicing on the body. We got the heart doctor, we got the liver doctor, we got the kidney doctor, we got the skin doctor. But do we have the mind-body doctor? No. And this has had a tremendous effect on us. It's slowly changing. And in some parts of the countries, and even this town, we do have some providers now who take this in consideration. In essence, they're teaching wellness besides the illnesses that they're treating. But this is very important. Rene Descartes, he was sort of breaking with medicine from years ago, like Hippocrates, who actually taught the mind-body connection. Yeah, the ancients, thousands of years ago, taught the mind-body connection. But then we went through a stage of 100 years where we thought you had an illness, it was because you were sinful, or it was punishment from God, different things. So we went through stages of change, and Descartes was trying to get us away from thousands of years ago, in essence, ignoring the true physical effects of an illness, psychological effects. So that was understandable. They even published a book, Descartes' Error. I have it at home. I read the book. It's an interesting book to read. So cancer, let's get into nutrition a little bit here. Pullen's book. If you have cancer, I think this is a great one to read. Prevention, remember, if you eat and exercise nutrient-dense foods, for example, that are full of vitamins, minerals, phytochemicals, and nutrient-dense type diets, say 80% of the time, these are the enzymes in your body that run the metabolic activity. They don't have any calories in them. The metabolic activity, they will literally run the chemistry of your body. They quickly repair your DNA, for example. They reduce oxidation. Free radicals cause cancer. Our atoms, each molecule has electrons around it. And bad foods, for example, radiation, smoking, for example, lack of exercise will cause free radical damage to your DNA, and that's what causes cancer, damage to your DNA. But if you're eating nutrient-dense foods, it repairs the DNA by reducing oxidative stress, reduces free radicals. For example, eating meat, say 7 days a week, causes oxidative stress, causes free radical damage, it causes increase in cancer rates. Also, you fry the food, what does that do? Increase the cancer rates. Exposes to toxins from the environment, for example, can increase cancer rate. They study the blood of babies born from the umbilicus, they draw blood, they get 200 foreign chemicals in them. From what? From farming, all the pesticides and herbicides that are in our environment. Non-organic food, you're eating a lot of it. What's it got on it? Pesticides and herbicides. And then you eat it. So it's important what you're eating that you know where did it come from. You go to the restaurant, you order fish, for example. Is it from the ocean, which is eating the plankton, the good plants, for example? Or is it from a fish pond where they're feeding it fatty foods, a lot of sugary products to fatten them up, so you have that fish that has a lot of fat. So when you eat an animal, what you're eating is what it ate. So if you're eating steaks every day, and they had cattle farms, and they fed them, they put them 6 months in pasture, 4 months in but cages with 10, where they teach them how to eat corn, and then they have a trough of corn going by, which has been genetically modified. Wheat has been genetically modified, never tested in humans, and they're testing on you right now, and that's what the cow eats, and then it's slaughtered in another very nice way, and then you eat it. What are you eating? What that beef ate is what you are eating, and very unhealthy. Cancer rates of meat eaters goes up. You fry the food, goes up. Joe Furman wrote a book called Immunity, Complete Immunity, where cancer rates go way down. He speaks a lot about the chemicals in food. IGF-1, insulin growth factor, is a big one in the cancer thing. That's in meat. It's not in plants. It's in meat. So meat eaters have increased rates of cancer. So what's the anti-cancer diet in essence? Well, 70-80% vegetables and fruit, for example. Maybe some turkey, some chicken that's been organically raised, or you could be total vegan or vegetarian, whatever. But I'm not that hot on being a total vegetarian, for example, because I drink milk products and it has casein in it. Casein helps make cancer. So milk has increased rates of cancer associated with it because the cow is in a cage, not out in the pasture eating grass and being fed chemically food, and they put on pesticides and herbicides and hormones to make it produce a lot more milk because it's produced through a gland. They increase the yield of milk 10, 20 times because they put it in a cage, fatten it up, and they put pesticides and herbicides in it. And of course, and hormones, milk has in it 24 hormones. And then your children are drinking the milk, and the amount of estrogen they're exposed to, now they're menstruating at age 7 or 8, they increase the length of time that they're on estrogen. Guess what? Cancer rates go up. That's what we've all studied. Milk's not a health food. Past age 2, you don't eat milk. Mother's milk is a health food. Of the maybe 3,000 odd mammals that we have, they all make different milk. No mammal drinks the milk of another mammal. Why is that? It's all different amount of sugar, fats, proteins in it. Okay, no mammal would drink the milk of no mammal except us, and it's been proven. American Nutrition Society has said a properly balanced vegetarian meal after age 2 is totally consistent with excellent health and nutrition. Yes. Yes. That's a scientific paper. I can give you the reference. So if you think you need protein to build muscles, baloney, baloney. Because the amino acids in plants like nuts, for example, broccoli, full of protein. If you eat 100 calories of broccoli, it is twice the protein in it than 100 calories of beef. Yeah, except you got to eat a lot more broccoli, but that's been proven. So don't think you got to eat meat to get the protein. You can have huge muscles. I mean, look at the elephant. Look at the horse. Look at the hippopotamus. Are they meat eaters? Oh, they're vegetarians. So you can get huge muscles eating that way. Okay, and all I ever said, I want you to, eat about 80% vegetables, fruit, minimum, and make it organic meat if you can. Exercise a half hour a day if you can. Just good walking, for example. You probably live to be 100, and your cancer rates will go down. Then watch you put in your fingers, your forks, etc. So the phytochemicals, the thousands, 25,000 phytochemicals in foods of color, okay, run the metabolism of your body, make you healthy. They repair your DNA, they reduce your free radicals, they increase your immunity. They're the healing enzymes. Cruciferous vegetables, those are vegetables that have, as a flower, they have a cross, that's why they call it. But that's kale and cabbage and onions and mushrooms, and very healthy. Beans are very healthy, prevent diabetes, prevent cancer. Seeds and nuts are just great. Dr. Furman with Super Immunity, by Dr. Furman, that book I refer to, eats an ounce of nuts a day. I do. Actually, Furman eats 2 ounces. Don't have to eat 2, but 1 ounce. That's my snack. Don't turn your car into a kitchen, okay? I've done it in the past. Okay, don't do that. But if I'm getting hungry, I'll eat 4 or 5 nuts, and my appetite's gone in about 5 minutes or so. So, because we all, through the stress of the day, we feel a need for a little something. Also, Furman showed that if you put some nuts or seeds on top of a big salad, you want to eat a big salad every day, and I do every day, it'll increase the absorbability of your phytochemicals tremendously. Also, if you do juicing and smoothies, use these like Vitamix, Ninja, any of these machines, they will break up the membranes and cells of these vegetables, and then you drink it. That puts out so many more phytochemicals. So to some smoothies and some juicing every day or every other day, critical. You can put so many phytochemicals in your body that is so healthy. And they stimulate, I had it for breakfast today. I have no appetite now. I had a nice smoothie. And one thing about smoothie, it still has some fiber in it, which reduces, so some of the things you take in the rest of the day will go out in the stool. Fiber is not digestible. But juicing is highly concentrated phytochemicals. So if I had cancer, man, I should do some smoothies and juicing. But just for anybody, just for good health. The gold, in essence, I mean, the best ones really are beans and mushrooms. If a woman were to take a fresh onion, eat 1 fresh slice, and 1 cooked mushrooms, cuts breast cancer rates 50%. Is that so hard? Yeah, it's because of the phytochemicals, the isocyanides in there, and the lectins in there, very healthy for you. So depression, hopelessness, death of a spouse, marriage trouble, all reduce the will to live, and are not good prevention of cancer. Our thought process and what we eat actually has physiological consequences. How we think has physiological consequences in our body. So to try some visualization, remember I said visualization is how you can speak to your subconscious mind. So to visualize every day a good outcome. Visualize how you'd like to look 6 months from now, what you'd like to be going on in your life. They use visualization a lot in sports. Professional golfers, when they step up there, they're visualizing. They're not thinking about how they're going to hit the shot. I do it playing tennis. But you can make things happen in your life. You can affect the enzymatic activity, your metabolism in the body, by what you visualize. So have a positive visualization. So don't be a statistic. Don't be a statistic. Okay? Remember what I said? So let's kind of lead to the healing here a little bit. There's healing in art because you're speaking to the subconscious mind. You're visualizing, okay? And music. Music rearranges the whole darn brain. So if you can play a musical instrument or dancing, that's a great exercise for your dancing. I take a dance lesson every week. Do some dancing besides. I go to Sweet World Music, which I consider to be God's place, and take music lessons. I take singing lessons. Singing lessons, piano lessons. To bring music in your life speaks to your neurotransmitter, makes you feel good, and it leads to the healing. So music and healing is a big thing. It's a big thing, and try to stay at work. Be creative. Freud said we have a creative and a destructive impulse. Those are two impulses of human beings. That's what Freud published about in the 1890s, 1910, in those years. It's kind of interesting. So to have some self-love or to bring love into your life can have tremendous effects and gives you a purpose, tremendous effects in your healing your mind. So avoid depression if you can. And so don't be docile. Participate in your health care, and if your provider never brings up this part of cancer, you do it. Read these books. You can go to YouTube, Cashman, or CashmanHealth.com. Resources, 200 TV shows in there from this wonderful place, the Public Library, Public Access TV. You can see those shows and get more educated about it. Many different aspects of it. And so get a massage, improve relationships, and read Siegel's work and Furman's work and my work. So maybe put some DVDs, CDs in your life that you watch every morning while you're driving. Listen to a hopeful CD or music. I finished a hard day of surgery, and I quit that 2 years ago. Surgery, I get in the car. Immediately I put on music. And I'd be driving down the street, and my stress would be gone just in a few minutes, because that music, sometimes I'd be conducting the orchestra. Now that I'm taking singing lessons, I'm singing New York, New York. I sang it this morning on the way here. Okay, so I want you to do that because it rearranges your brain and brings spirituality into your life. Okay, and then they talking about imaging, which is really critical. Fighting Cancer with Wisdom is an excellent book. Written by Marty Rossman, and he spends a great deal of time speaking about imaging. Very important, because this is how you can you want to speak to your subconscious mind quickly and rearrange your hormones and neurotransmitters. Use an image. This is really a quick way to do it. And these are the things he says about it. It's comforting, tremendously stress relieving, stimulates your immune system. Remember how you think affects your immune system through the neuropeptides, through the hormones, directly through nerves. It's enjoyable. It's better than worrying. It can show things about yourself and life that are good to know. Can relieve pain. Yes, if you are mindful and you have a certain pain and medication isn't working, and a lot of medications are addictive, so you might try to avoid them. I know of cancer patients who went to pain centers, and they gave them shots all the time to make some money, and then they give them prescription narcotics to make sure they come back. Then they were cured of the cancers. I have two friends who were cured of the cancer and died of drug addiction. Yeah, interesting. Certain cancer patients absolutely need them. Certain accidents, certain injuries absolutely need them. But if you can, keep it as short as possible, because the addictive process can kill you. Just pick up the newspaper. You see it all the time. See it all the time. So imagery can prevent complications and pain after surgery before you go in the operation. Visualize a friendly atmosphere and that you not have much pain, and it actually may happen. If a provider is there before an operation or after an operation, a minister or a rabbi or whatever, I would always speak to them. I would say a prayer with the patient, no matter what their religion and spirituality. I took advantage of that. Remember what I said? Spirituality and healing. I encourage the nurses in the hospital room, if there's a priest there, a minister there, a rabbi there, whatever, there, take advantage of it and pray with the patient. Prayer will cause changes in the neurotransmitters, the hormones, the neuropeptides, and whatever their belief is. Maybe somebody come to work for them and cure them of this condition, make them feel better at least. So imagery can help you access your strength and encouragement. The biggest pharmacy in the world, I may have said it before, is your body. No outside drug works unless a receptor in your body has been trained to react to it. Yeah. So we were speaking about morphine. You have morphine receptors in your body to begin with because you make your own morphine called endorphins. Candace Pert, her research led to that. It was proven. Imagery is very, very important. And I've had patients, in matter of fact, I can tell a lot of great stories about people who use imagery, like, for example, they do some deep breathing, some yoga, and they have a Pac-Man come in and eat up their cancer cells, or chemo coming in, destroying their cancer cells. That's imagery. Now, once you read something about it in these books I've recommended, and do it 5 minutes 3 times a day, I think so. Imagery is very important. I want you to know more about it. To the Pac-Man coming in, or radiation as little bullets killing your pet cells. I want you to visualize that. It's more likely to happen. So in summary here, what I'm saying, don't just be the ill to the pill to the ill. I want you to take your chemo. I want you to take your radiation, all these things, but get second opinions, and then participate in your health care. Learn about the mind-body connection. Maybe and write everything down that you're going to do. Maybe develop a room where you deposit things that you are going to do, from exercise equipment to walking as possible, and visualizing the healing coming in. Thanks so much for listening. Come to our lectures at CashmanHealth.com. Remember the YouTube shows, 200 of them you can watch for free. Books to read are on there. I give lectures at Lutheran Hospital twice a year. Attend some of those. They're free. Especially I have one on diabetes coming up the 29th of January, I think, Monday night at 7. And I teach you how to get rid of type 2 diabetes, 30 days. Type 2 diabetes has increased cancer rates associated with it. I can eliminate that for you. And I love you for listening. And this is a labor of love, no doubt about it. But it'll lead to the healing. And the biggest thing to me, participate in your health care. Learn about proper nutrition, exercise properly, bring spirituality into your life. Learn about the mind-body connection, which we spoke about. And I want you to do some reading. Thank you very much. We love you all. If you see me, speak to me. I'll certainly give you a hug and listen to what you've got to say, attend our lectures. We love you all. Namaste.